How's it going, everyone? This is Brad Williams with Over 40 Fitness Hacks. I have my new season co-star with me, Dr. Ken Zweig. How's it going, Ken?
It's going great, Brad. Thanks for having me on.
Absolutely. Thank you. Well, cool. Well, Dr. Ken, let's go dive into, just very specifically more of sleep disorders and behavioral change for that. Tell us about sleep disorders? I mean, we all know insomnia, but we probably don't know all the other ones out there. What kind of stuff can you help with? And
Yeah,
how many people suffer from this? I'm sure everybody.
Everybody. At some point, everybody. Yeah. Well, welcome to America.
Yeah.
I am a very big proponent of sleep and sleep quality. And this is something that also goes back. Actually, this was before behavior change. I realized when I first started, I was seeing all these people with mostly diabetes and high blood pressure, and I was looking at this and saying, hey, well, what's behind all this? Why do so many people have it? And I started reading some stories about high blood pressure and how there's big association with sleep. I came out of residency around the time when sleep apnea started becoming a big thing, and sleep labs started showing up on every corner. And all of a sudden, one day there was not a sleep lab in the area, and then 2 years later, there's 300 of them. They were showing up. They just popped up everywhere.
Yeah.
And because we recognized it and we knew it was important, and then so I started looking into why this was showing up everywhere and all the associations with sleep apnea and then sleep in general, and realizing that a lot of what I see was related to sleep disorders, and started doing more and more looking into it. Now I've come to the point to believe that the absolute key to behavior change and good health and happy health and a good life all starts with sleep.
Yep.
Without good sleep, I need that as foundation. Without good sleep, it's all just rearranging deck chairs, right?
Yep. Well, in my world, it's nutrition, exercise, and recovery, and that's it. And that the biggest recovery one is you can take every supplement in the world you want for recovery, but it's far second to sleep. That's number one. So if you can't handle that, then we got problems.
Right, exactly. And it's the same thing. I always say there's four things to good health. It's eat right, exercise, get plenty of sleep, and don't be stupid. Don't drink too much or smoke or anything like that. But really, it starts with sleep, because if you don't sleep well, it's hard to eat right. It's hard to exercise. If you're tired, you're not going to get up and go for a run. And when you're tired, you make these hormones that make you crave fatty foods. You don't get full as easily. You're hungry, and you just make bad choices. You try to basically eat away your hunger, and so it's a great way to gain weight is by not getting enough sleep.
Yep.
And so everything that's good in your life, they've shown that almost directly related. The less sleep you get, almost one-to-one, things like the rate of high blood pressure, heart disease, strokes, chronic pain, depression, anxiety, cancer, making less money, whatever you want in life, it comes with more sleep. And so why wouldn't you do that? But unfortunately, in this country, there's the mantra that you can sleep when you're dead.
Yeah, that's what I used to say too.
Right. I did too. When you're a kid, you're stupid.
Not anymore.
Not anymore. Now you realize, okay, I need this stuff. Yeah, this is important. If you use that mantra, it's going to happen a lot sooner than you think.
Yeah.
And so it's all really got to start with good sleep, and it can be hard because a lot of people don't always feel sleepy. But if you get less than 7 hours of sleep a night, you are sleepy. You just may not feel it. Certain people have different thresholds for pain. People have different thresholds for sleepiness. And so even though you may not feel sleepy, if they do studies on like reflexes, memory, and retention, and all these other markers of sleepiness, find out that even though you don't feel sleepy, you almost certainly are sleepy. And so 7 hours is sort of the gold standard. We have to shoot for at least that.
Yeah.
Maybe more, but you don't want to go below the 7 hour mark a night.
Absolutely. As far as like different causes for, sleep disorders, you mentioned sleep apnea. What are some of the other ones that you keep coming across?
The big ones, well, sleep apnea is huge. I mean, that's, that one can be really, really impactful. And depending on the study you look at, 5 to 10% of the US has sleep apnea.
Yeah.
So, which is a big chunk. That's huge, and that can have a huge impact on health and like I said, a lot of the other disorders. Insomnia, 60% of the U.S. Suffers from insomnia at least once a month, and something like I think 30% have it chronically.
Wow.
At least 4 nights a week. That's devastating. It absolutely can ruin your life if you have it that often. And so those are by far the big ones. There's a lot of other ones that are sort of wild, crazy sleep
Yeah.
studies. They don't happen very, very often, but there's narcolepsy and there's something called parasomnias, where, like sleepwalkers and
Yeah.
who eat in their sleep or have hallucinations, in the daytime, like in narcolepsy, where they go into these sleep hallucinations, and there's all kinds of other ones that are really kind of esoteric and not very common. It's
Yeah.
really it's insomnia and sleep apnea are the main ones.
What
There's a
about
lot of
just
other ones.
stress, like the corporate executive working 7 days a week, because he's salaried and there is no hourly. And if you want to climb the corporate ladder, there is no, 4 or 5 hours of sleep. And I mean, that's just self-inflicted. That's not
Right. Yeah.
anything.
So I guess, and that's a good point, actually. I guess I was throwing that more in the insomnia or inadequate sleep category.
Mhm.
That is, that would be sleep deprivation disorder.
Okay. Yeah.
And also, or shift work disorder too, where people get enough sleep, but it's only during the day, not at night. And that also shows a lot of problems too. When you sleep during the day and work at night, or don't give yourself enough time to sleep, or you're stressed and you have enough time to sleep, but because of that stress, you can't sleep, which is insomnia. And, or if you drink alcohol, which is a common reason to not be able to sleep, and wakes you up in the middle of the night. All of these, whatever it is, anything that decreases the duration and or the quality of your sleep, all result in more or less the same outcomes.
Yeah.
And that is a poor and miserable life is that outcome.
Absolutely.
So getting it addressed, and there are plenty of things that we can do to help with sleep disorders. And so a lot of people call it the fifth vital sign. That how many hours a night do you sleep? And I make sure that I ask really everybody about their sleep and sleep habits and how well they're doing.
Yeah. What do you think about all the, the trackers everyone's got now, like the Fitbits and, whatever phone they have, and they've got the little smartwatches. That's what I was trying to say. And they track all that stuff. And, I've used it. I don't know how accurate it really is or anything, but it seems, at least for me, when I did it, I mean, I felt like I slept like a grizzly bear. And usually I only sleep 6 hours. I probably should get a little bit more. But then when it shows you your quality, I am dead out on what it shows on the smartwatch. And I feel like I don't wake up at night, and even my wife says it. But how do you think of that technology?
So I'm a big fan of fitness trackers.
Okay.
I think they are certainly better for steps and tracking your fitness, because that's what they're called. So and there's no question that they've shown that people who wear them do better. They walk more, they run more. They're more likely to stay on their fitness goal.
Motivation, yeah.
It's motivational. It gives you feedback. Anything that gives you feedback is going to be great. So it gives you feedback that says, "Hey, you're being a couch potato. Get up and do something." Or "Hey, you did a great job today. Keep running." And so that kind of feedback is really, really helpful, especially when it's instant feedback like that.
Yeah.
As far as sleep goes, it's something called actigraphy, which that has to do with movement, and it's okay. It's not nearly as good as it is for a fitness tracker, because depending on the stage that you're in, you move in your sleep and you move when you're awake, and you stay still in your sleep and you stay still when you're trying to fall asleep and you're still awake. So it's not perfect, but what it does do, so using it for one night really doesn't give you much of an information set.
Yeah.
But if you use it for a month or 3 months, and then look at how your average is and how it's doing over time, a lot of the noise and the inaccuracies can be weeded out. And so if you look at your averages over time, that can be really helpful. So as far as using it for one night and showing the quality of your sleep in one night, they're not great. But if you use it over an extended period of time, it can give you a good estimate of what your total sleep quality is for an extended period. And so they can be helpful from that standpoint.
Gotcha. I assume if someone's working with you on their sleep disorder, it's got to be number one thing, you're going to send them to a sleeping clinic, or what's your kind of first couple steps?
Rarely. Yeah. No, I usually manage it myself. Yeah. Most of the things I can use manage. So it depends on what it is. If it's insomnia, which, oh my God, I see it all the time.
That's number one. Yeah.
Number one, yeah. So, there's something called sleep hygiene, and it's just a whole number of steps of things that you can do to help make your sleep better. Because we tend to be pretty bad at helping our sleep out. So there's so many competing factors. You got your phone and your TV. You've got lights on all the time, which sort of throw things off because we're made to go to sleep when the sun goes down and get up when the sun comes up. The artificial lights really screw that up, and especially electronics, which have more blue light, which simulates the sun more and suppresses your sleep drive. And so a lot of electronic things really make it tough. Caffeine, alcohol, drugs that really can impair the quality of your sleep. A lot of the sleep aids you could get over the counter are awful. They do not make you sleep. They make you sedated. That's different. Drug-induced sleep. It's not natural or real sleep, and there's a very big difference. Other than melatonin, which is something that which is fine and certainly can help. So I go through a lot of what we call sleep hygiene and talk about the things that they can do to help make it better, and keeping a regular sleep and awake time, making sure their bed is comfortable, making sure that the bedroom is cool. You want it to be about 65 degrees. Most people do not keep it that cool, but that cool, it really can help you sleep. Make sure it's dark and quiet, and again, really regimented about sleep and wake times, including the weekend. So whatever time you go to bed, you want to make that your regular bedtime, and then shoot for 7 to 8 hours later to get up and make that consistent, including the weekend. There's something called social jet lag. Which is, have you heard of that? So it's a relatively new thing, but it makes perfect sense. If you fly to France and it's 7 hours difference time zone, and then you get there and you go to sleep at their time, sleep for 8 hours and wake up, you're going to be exhausted because you just screwed up your circadian rhythm. Well, if you do that here and you go to bed usually at 10, but on Saturday night you stay up till 2 and then get up at 10, we got 8 hours of sleep. You're going to be exhausted when you get up.
And then you
just change 4 time zones.
And then most likely they're going to do it again at some point on Sunday, and then that's why everyone walks in Monday, and Monday's the worst day of the week.
Exactly. That's
they're feeling like terrible.
You feel terrible, right? So and it's hard. I get it. It's not easy to do. But the better you do with it, the big thing is not just about living longer. The better you do with it, the better you feel. And that's who doesn't want that, right?
Yeah, well, going back to melatonin, that's awesome that you see that as an okay thing to kind of use probably every now and then and not too much. What do you think about the children's melatonin and putting young toddlers? I don't know if you know that's a thing, but there's we have a 5-year-old, and part of the thing is we're suffering as parents with a 5-year-old just trying to get our own lives going with work and everything, and there's sleepy gummies, they call them, but they have a very watered down version of melatonin in these gummies, and it knocks them right out. So what you think, melatonin and too much is a problem like caffeine is, or is there any studies that show that? Or I don't work in kids. I only work in adults. I don't see kids, so I'm not familiar with that. And how about for adults? For adults, melatonin works fine. It's you can get a dependency on any pill. With melatonin, it's more of a psychological dependency. Than that. If you take it, 7 days a week. 7 days a week, and then one night you don't take it, and you think, oh my God, I didn't take my pill. I'm never going to be able to sleep. It becomes self-fulfilling reality. Right? But it's not. There's no actual physical withdrawal from it. But kids, and the one thing I see with kids, and I know there's more from being a parent than from being a doctor, is that we tend to think that kids should be on our sleep schedule, and that's not the case. Kids need way more sleep than we do, and that they should probably go to sleep a lot earlier than we tend to let them. And even though they fight it, boy, they fight it. Oh God. So we also don't want them waking up earlier than us too.
Well, that's true. Yeah, but a lot of times if you put them to bed earlier, they actually sleep better and longer. Some depending on the kid. So so that's the biggest mistake I see with kids. But it's just at every age, the sleep is just so important. Yeah, no, I hear you. I agree. So Dr. Ken, how does my audience get a hold of you? More for the behavioral change and sleep disorder. Sure. Is there a website, or do you have anything they can download? Or Sure. Yeah. So the best place to go is to my practice's website on NVA. So that's N as in Nancy, V as in Victor, A as in Apple, familypractice.com.
Okay.
So it's all one word. And on there, if you go to the media section, I have a blog there. We have a lot of videos, something called a town hall that we do about once a month on all kinds of different subjects. So we try to keep our patients as informed as we possibly can.
Okay. And then some website if they want to book a session with you or.
Sure. Yeah. That's the best way to find us.
Okay, cool. And my audience always knows that I, throw all that in the podcast details so they can just click the link instead of trying to, remember that, type it in.
That's great. Good. That's
so
much easier.
Yeah. But yeah, no, sleep is very huge in my world too. And then it's the most looked over aspect of it. Everyone wants to do the bodybuilding, working out, which, nutrition's even more important than that. And then on top of that, sleep, and no one's doing anything with that. So it's great that there's people out there like you that are putting more light on this and get us as healthy as we can be.
That's the goal. That's my idea. So,
that's it.
That's great. Yeah, I'm glad you're doing it too by bringing it to light with the podcast, making sure that everybody, just gets the information first. That's the first stuff is education.
Absolutely. Well, thanks, Dr. Ken. I really appreciate you being on the show, and we'll check back in with you probably sooner than later.
All right. Sounds great. Thanks so much. I really appreciate it.
Awesome.